In fact, when we evaluate patients for leptospirosis, you have low risk, moderate risk, and high risk. Low risk is someone who may not have an open wound that is visible to the eye, but still comes in contact with flood water. Why? Because you could actually have what you call microabrasions or small wounds, paper cuts. Maybe you had your manicure or you have an ingrown toenail that could actually be an opening in your nails, in your skin, where the bacteria from the urine of rats can cross over into your bloodstream. For those at moderate risk, these would be people who have a visible wound or maybe a healing wound, and then the wound comes into contact with the floodwater. So that's a logical explanation that the bacteria will find it easier to enter your body. The high-risk leptospirosis patients would be those living in areas or maybe working in flood-prone areas like rescue personnel or street sweepers, street cleaners, where their exposure to floodwaters is more often than once a day because they keep coming back to that area.
Okay, so it is really a risk for anyone, even if you don't have a visible wound.
Yes.
How serious is leptospirosis? What are the symptoms?
It is very serious, but I'd like to highlight at this onset that leptospirosis has an incubation period, meaning the time it takes for symptoms to appear. The incubation period can range from as short as 2 days to as long as 30 days. On average, Attorney Karen, you will actually see this in the clinics around 7 to 14 days. If we talk about what's happening to our Metro Manila right now, we are seeing a lot of cases right on the dot, 2 weeks after Super Typhoon Karina and the strong southwest monsoon hit our area and resulted in a lot of flooding. So that incubation period runs at 7 to 14 days. It has symptoms like fever. Actually, most of the patients complain of anuria, which is a medical term that means no urine. There is no urine that forms. There will be 1 to 2 days. Some patients, kids actually saying, Mom, Dad, I'm not feeling well. I haven't urinated for the past 24 hours, which causes the parents to bring them to the emergency room, typically the National Kidney Transplant Institute, but this early I wanted to say that's not the only hospital that can handle it.
Okay, so this is good that you're telling us what the symptoms are, so that if people hear about this and think, okay, I think I have one of the symptoms, what should they do? Should they immediately go to the hospital?
Yeah, so there will be other symptoms, by the way. You can also have typically body pains, particularly at the calf area, or in Filipino, alak-alakan, so the calf area. Then that would also be signs of it. You could have yellowing of the eyes. You could have a change in the color of your urine and stool. And these, I really have to emphasize, these will appear at a somewhat midpoint or later stage of the disease. Because for the first few days, 7 to 14 days, you will not feel anything. And the key public health message here, Attorney Karen, is as long as you waded in flood waters, you have to see a doctor to get your prophylactic antibiotic.